I don't think people appreciate just how screwed Ontario healthcare is because of Doug Ford. Because Bill 60 is going to essentially prevent these private clinics from being scrutinized by the public. They'll be able to get away with whatever they want, including enriching themselves on the public dollar without any way of knowing. These clinics are going to be funded through the public system and are also going to be allowed to sell expensive extras to patients at a time when their judgment may not be best, when they're emotionally distressed, or to people who may be elderly and not understand contracts, or to people whose first language might not be English. And Bill 60 is going out of its way to create a new sector of our healthcare industry that is going to be managed under a new director. And this director does not have to be an employee of the health ministry, and therefore they are not subject to the strict rules for conflict of interest and public and financial accountability, meaning it would be possible for Ford to appoint a lobbyist or somebody who is closely tied to a corporation that is invested in private healthcare. Bill 60 ensures there is no financial disclosure requirements on the director, who will have sweeping powers over awarding the clinic licenses, meaning they could have tons of stock in Loblaws and award a bunch of contracts to their buddy Galen Weston. They could even be related to a person they give contracts to, and there is nothing wrong with that according to Bill 60. And on top of that, there's going to be no accountability from the government and no way for people in the public to find out this information. Bill 60 also got rid of the requirement that clinics have to be inspected by the Ontario College of Physicians and Surgeons. So who's going to be inspecting these clinics? No new authority has been presented, meaning that most likely clinics are going to be inspecting themselves. Yeah, of course we can entrust massive companies to inspect themselves in regards to our healthcare, right?